Good day, everyone. My name is DAKKSHAN. I am from group number 25, and today I'm going to demonstrate to you how to observe a patient that has just had a pacemaker surgery. So, first of all, let me clarify to you what a pacemaker is. A pacemaker is actually a electrical device that is implanted under the chest or in the abdomen to help the patient from irregular heartbeats. So, how does it help the patient from irregular heartbeats? So, what it does is it actually helps to carry electrical current signals directly into the heart muscles to replace the natural lost control of the heartbeats that were present in the patient before this. So, there are two types of pacemakers. One is the demand pacemaker, which only sends electrical signals when it's needed, and then there are the other pacemakers that constantly send signals to the patient's heart, of course. Now, before we get into how to observe a patient with a pacemaker implant surgery, first of all, let me show you some pictures of what a pacemaker may look like, and also like the site of the pacemaker implant. The left demonstrates what a pacemaker looks like, and the picture on the right demonstrates the site of the implant. Now, without further ado, let's get into the observations of a patient with a pacemaker implant surgery. So, when observing a patient that just had a pacemaker implant surgery, the first thing you will have to do is you will have to check the pulse of the patient. Okay, sir, I've taken your pulse rate now. Once you have taken the pulse rate, you will have to record the pulse rate reading. If there are any irregularities or changes below the present pulse rate, you will have to report it to the nurse immediately. The next thing that you will have to do is you'll have to check the site of the implant. Now, if there is any discoloration or maybe if it turns a little bit too red, it could be a sign of infection. So therefore, you will have to report it. Another thing that you will have to report to a nurse is if the patient has hiccups. So, sir, have you been facing any hiccups? No, sir. Okay, that's good. Okay, so if there are hiccups, it could indicate that there may be some problems with the surgery, or maybe there might be some problems with the pacemaker. Last but not least, you will have to keep any cellular devices or maybe anything like microwaves or any electrical items that may release waves that it could disrupt the function of the pacemaker. So those are the steps that you have to observe in a patient that has a pacemaker implant surgery.